The needle's in, the bag is hung, now how fast should it run? This is the part of Roman IV therapy that scares people, and it really shouldn't. The maths here is just multiply and divide, the kind you can do on a scrap of tape stuck to the bag. In this section, we'll build one drip rate formula you can lean on every time. Learn to read the drop factor straight off the tubing package. Size a fluid bolus for an adult and for a child, and work out how many milliliters of a drug to push. Slow, plain and correct. Let's count some drops. Start with the one number that makes the whole thing work, the drop factor. Every administration set has a number printed on its package. That's how many drops it takes to make up 1 milliliter as fluid falls through the drip chamber. There are two families. A macrodrip set runs 10 or 15 drops per milliliter through a big opening, and it's built for fast volume. A microdrip set runs 60 drops per milliliter through a tiny needle-like orifice, giving you fine control. That's your choice for medication drips and for children. So before you calculate anything, pick up the wrapper and read the drop factor. It is the GTT per ml number your formula needs. Here is the formula for the whole section, and it never changes. Drops per minute equals volume in milliliters, times the drop factor in drops per milliliter, divided by the time in minutes. Three things go in: how much fluid, which tubing, over how long, and one thing comes out. The rate you set with the roller clamp. Write it on tape if you like. The only discipline is units. Volume in milliliters, drop factor off the package, time in minutes. Get those three lined up, and the answer is just arithmetic. Let's watch it work with real numbers. Watch the numbers drop into place. We want to infuse 250 milliliters of normal saline over 20 minutes, and we've chosen 10-drop macrodrip tubing. Volume 250 milliliters. Drop factor 10 drops per milliliter. Time 20 minutes. Top of the fraction first. 250 times 10 is 2,500. Now divide by 20 minutes. 2,500 divided by 20 is 125. So you set the roller clamp to 125 drops per minute. That's the answer, start to finish, one formula, plain numbers. Let's lock that example in and read it like a recipe. The order is 250 milliliters of saline over 20 minutes through 10-drop tubing. Plug it in, 250 times 10 divided by 20. 250 times 10 is 2,500. 2,500 divided by 20 is 125. 125 drops per minute. Notice how counting drops in the chamber for a few seconds lets you check yourself against the clock. If you're seeing far more or far fewer than 2 a second, recheck the clamp. The formula sets the target, your eyes confirm it. Now a microdrip example, because the drop factor changes and nothing else does. Say you're asked to give 100 milliliters over 30 minutes using a 60-drop set. Volume 100. Drop factor 60. Times 30. 100 times 60 is 6,000. 6,000 divided by 30 is 200. 200 drops per minute. The drops are small and fast. That's exactly why microdrip is used for tighter control and for pediatric fluids. Same formula, just the 60 in place of the 10. And here's a handy check for microdrip. At 60 drops per milliliter, the drops per minute equals the milliliters per hour. So 100 ml/h is 100 drops a minute. Two more must-knows. First, KVO, keep vein open, sometimes written TKO, to keep open. That's a deliberately slow drip, just fast enough to stop the line clotting off. With 10-drop tubing at about 60 milliliters an hour, that's 60 times 10 over 60 minutes, which is 10 drops a minute, roughly 1 drop every 6 seconds. Second, the Fluid-Bolus. For an adult, an isotonic crystalloid bolus is given to support perfusion, titrated to a systolic of about 90, not back to normal. For a child it is always weight-based, 20 milliliters per kilogram. A 15-kilogram toddler gets 20 times 15, 300 milliliters. Then you reassess before repeating. Last piece, how many milliliters of a drug to give. The label tells you the concentration, the weight of drug in each milliliter, and the order tells you the desired dose. The formula is desired dose divided by concentration on hand, equals the volume to administer. Example, your protocol says 12.5 grams of dextrose for hypoglycemia, and you have a 50% profil, 25 grams in 50 milliliters. Concentration is 25 divided by 50, which is 0.5 grams per milliliter. So 12.5 divided by 0.5 is 25 milliliters. Always check your units match, dose over concentration, and the volume falls right out. That's the maths drop factor, the one drip rate formula, boluses for adults and for children by weight, and dose over concentration for drugs. Next section, we take these numbers to the patient and run the fluid challenge for real, watching the response. Everything you read more on for this section is on screen.